Hello and welcome to Cannabis Patient Reviews. My name is Alex Fraser. I created this channel for a multitude of reasons. I want to talk about medical cannabis in the UK. I want to talk about my own experience as a medical cannabis patient. To that end, I suppose I should introduce myself a little bit. My name's Alex, like I said. I'm 27 years old. I live in Brighton in the UK. And I have Crohn's disease. I've had Crohn's disease since I was 19. I was diagnosed in 2010. Some horrible symptoms: pain, nausea, vomiting, diarrhea, and I've been using cannabis for eight or so years now to mitigate those symptoms and to control my disease, and also to help with the mental health aspects of being unwell as well. So today, what I really want to do is talk to you about the new panel that's being set up by the government to assess medical cannabis patients and to see if they can push through licenses for those patients to get prescriptions during the 6 months of them doing a review into medical cannabis. So hopefully at the end of these 6 months, we will see some movement in terms of prescriptions being more widely available for patients throughout the country. However, in the meantime, the government have set up this expert panel to basically assess patients on a one-by-one basis and to see whether these patients will be able to access this medicine. So last week, BBC Newsbeat and Jim Connolly came and interviewed me about this process and about what I thought about it, and we sort of started the ball rolling into getting me started on this process. And this morning, I've just been and spoken to my GP. There's not a lot to report at this point. I told the GP about the panel. I've given him a link so he can read into that. I told him about the United Patients Alliance. It's an organisation that I work for that we'll be hearing a lot more about on this channel, I'm sure. And I've given him some research to do. He didn't give me a lot in terms of what he thought about cannabis. He didn't really even emotionally sort of respond to what I was saying when I was talking about it. I was as brief as I could be. There were a few other things that I had to talk about in terms of my health, which I will explain in a little bit. But I didn't get the impression from him that he was particularly interested or that he particularly wanted to express an opinion at this point. It is a very controversial issue, and I suppose he probably thought, I don't want to sort of put he doesn't want to put his opinion on the line so early on. So it's interesting. He says book an appointment with him in a week or two's time, and he'll have looked at it all, and we can go from there. So I will keep you all informed. The other thing I want to talk about, which I did mention to him as well, is mental health. So post-surgery, I had surgery, it was last year over the Christmas period. Spent my 26th birthday in hospital, and had a really horrific time of it. Basically, I had most of my large bowel removed. I've now got a colostomy bag, and it's been a whole heap of things to deal with in terms of recovering, in terms of my health. I've also got quite severe eczema, which I'm sure you'll see on these videos will flare at points as well. My face will be all red and sore, my hands will be all red and sore. And the combination of all of these things makes life incredibly difficult, and I admittedly have lots of serious mental health issues that I really do need to look at, basically around anxiety and depression, maybe even some PTSD-like symptoms as well. I also suspect I might be on the spectrum and slightly autistic, but this is something that I want to delve into, so I've got a referral to go and talk to some mental health team about that. And the reason I'm telling you about all of this is because there is a sort of pre-existing situation in the UK whereby people who go and talk to mental health professionals about their mental health, whilst also talking about their cannabis use, medical or otherwise, generally seem to be getting stigmatized and seem to find that access to certain therapies and medications is often denied to them because of their cannabis use, or that their cannabis use is generally misunderstood and thought to be problematic by the mental health team, rather than something that is making their lives easier and probably reducing their mental health symptoms, whilst it also reduces their physical symptoms of their illnesses. So this is something that I really want to look at in some depth. I want to look at it through my own personal perspective. I want to see what hurdles are presented to me as a cannabis using medical patient when I go and talk about my mental health. I wonder whether I'm going to be stigmatized. I wonder whether I'm going to have therapies. I really would love to be on CBT and have someone to talk to. I'm wondering whether that's going to be something that is presented to me, or whether my use of cannabis will be like, well, you can't have. And this is something that I hear a lot from patients, is that you can't have access to this drug. If you're on cannabis, you can't have access to, regardless of it being any contradictions. There are very few contradictions with cannabis, and there is one. I think it's cetrazine, isn't it? I don't know. Anyway, we'll look back and we'll comment on that in the next video. I'll make sure I've done my research. So yeah, it's a really interesting situation. It's a really depressing situation because a lot of people with mental health difficulties do find navigating our mental health system very difficult, and do find that people are often sort of have pre-existing ideas about cannabis and mental health, and that can make that whole situation really difficult for them. And I just want to look into that, my own personal situation, and see whether there's any problems or not with that, whilst we also go down this route of trying to get somewhere with this panel over the next 6 months. 6 months is a long time. We've got a lot of work to do. Please do follow and subscribe this channel, Cannabis Patient Reviews. For the time being, it's going to be my personal blog looking through and assessing this process. But long term, I'm hoping the channel will have all sorts of content on medical cannabis in the UK and further afield across the world. I'm hoping to talk to lots of really interesting people in the drug reform movement. And I'm hoping to get to know a lot of you guys as well. And hopefully you guys will have lots of interesting questions and ideas for content and stuff that I can be talking about re-medical cannabis. So yeah, in the meantime, of course, stay tuned to the United Patients Alliance and all of our channels on Facebook, Twitter and the rest, upalliance.org. And yeah, keep supporting medical cannabis. I also want to shout out to Families for Access, Voltfast, UK Cannabis Social Clubs, Brighton Cannabis Club, and all the other wonderful organisations that are incredibly supportive to me personally and to the reform and the movement in general. Peace and love, guys, and have a lovely day. Take care.